Low back pain affects more than 600 million people worldwide, but a new study suggests many are receiving unnecessary scans and ineffective treatments. Professor James McCauley is the director of the Centre for Pain Impact at Neuroscience Research Australia, and he's with us here in the studio this afternoon. Good afternoon to you, Professor. What sort of treatments do people commonly receive that might not be absolutely necessary?
Yeah, one of the most common whenever someone has back pain is they often want to try to understand what's wrong with their back, so to try and get a diagnosis. And often when they go to see a general practitioner, he may order a scan, for example, and we know that scans are still commonly ordered for people with back pain. The issue with that is that scans rarely tell us what's wrong with the back, even though it might seem to a person that if they can just see what's going on in their back. The thing is, they never tell us what's really going on in the back in a way that can help change the management of their back pain.
So it's a bit of a waste of time, potentially.
It's a waste of time, and it actually can be quite harmful because it can worry people. Like, I've never had an episode of back pain in my life, but I've been in a study in which I went into an MRI unit which looked at my back and produced a scan, and there were all sorts of things that looked like they were wrong with my back, but they clearly don't cause pain because I've never had any pain in my life. And that's a very common scenario. Lots of things look like they're going on in the back, but these are not associated with pain, and they can worry people.
What does this mean for patients? Should people be going into their doctor and saying, I don't want to scan anymore, or should they be suggesting other things to their doctor or taking the doctor's advice?
Well, they should be taking the doctor's advice for sure. And very often doctors respond to someone who's saying they want to know what's going on in their back by giving them a scan. So they feel pressure to do that. But patients should feel that they don't need to get a scan to understand what's going on in their back, and particularly don't need a scan in order to feel better from their back pain, in order to recover from their back pain.
Tell us about some of these medicines that are commonly used for back pain but may be harmful.
Yeah, well, the most worrying someone are opioids. Opioids are, particularly in the past, very commonly prescribed for back pain. There are about 1,000 deaths from opioid from opioids each year in Australia, and many of those are from prescription medications. So they should be avoided. It might feel like they're a strong pain medicine and therefore you need something strong to take the pain away. But there was a trial from my colleagues in the University of Sydney published 2 years ago that showed that actually they don't work for back pain. In fact, over the long term, they are associated with those side effects, but they don't seem to work. They don't seem to reduce pain.
And there are concerns about addiction as well. Professor McCauley, thanks so much for bringing in. It's great advice.
Thank you.
Good to see you. Thank you.